Do disc herniations cause low back pain, and do they need to be treated surgically? In this video, we'll answer those questions along with some exercises that might be helpful. Do disc herniations cause low back pain? And the obvious answer is yes, that's why this whole video exists, but the answer is really not that simple. On the one hand, we do see that there's an association between disc herniations and lower back pain in those less than 50 years old. But on the other hand, we also see that disc herniations are common in those without lower back pain. And we also see in this recent study that there is not an association between disc herniations and either present or future lower back pain. Plus, when we look at either the amount of inflammation or the amount of compression, it doesn't seem to explain the pain. So it's actually a little bit complicated to figure out whether the disc herniation is actually causing the lower back pain, or if somebody is just experiencing lower back pain and they happen to have a disc herniation at the same time. Which leads us to the question of whether we should have a surgery to remove the disc herniation, and the short answer is maybe. If we have sensory loss or motor loss such as foot drop, then surgery is probably the right way to go, but pain itself is probably a bad indicator of whether we should have surgery. When looking at outcomes for surgery to remove a disc herniation, which is causing sciatic nerve symptoms down the leg, it does appear that it performs better in the short term. However, when we look at 1 to 2 year outcomes, it doesn't appear that surgery actually performs better than conservative care such as exercise. And when looking at return to sport, it doesn't appear there's a difference between surgical treatment and conservative treatment. So without the presence of sensory or motor loss into the lower extremity, then conservative treatment might actually be a better treatment option. Plus, about 66% of disc herniations will actually resorb on their own, meaning that without surgery, the immune system will actually get rid of the disc herniation. So the need for surgery to remove the disc herniation is debatable. What exercises should you do for a disc herniation? In general, extension-based exercises are generally pretty helpful for those with a disc herniation. The prone press-up is a common starting place. Begin by laying on your stomach. The first progression is to prop yourself up onto your elbows. These are usually repeated for between 15 to 25 repetitions and can be especially helpful for decreasing pain down the leg. The progression is to prop yourself on your hands instead of your elbows, increasing the extension in the lower back. Additionally, we can add some lateral flexion into both of these exercises, which may be helpful in further reducing the pain in the lower back. If both of these exercises cause too much pain because the lower back is just too sensitive, there is always the cat-cow, which allows us to gently flex and extend the lower back until it's able to tolerate more movement. If we could tolerate these exercises, then the next exercise is to progress to a bird dog exercise to start loading the back extensor muscles. Start with your hands under your shoulders and your knees under your hips. Generally, the progression is to start with only your hands, lifting each one up into flexion, then only your legs, so extending the legs up into the air, and then going into opposite arm and leg, so that way we're still working those back extensor muscles and gradually increasing the load on them. Another exercise to increase the load on the back extensor muscles is the Superman exercise. To perform, start by laying on your stomach and then using those back extensor muscles to lift the chest up off the ground while keeping the hips on the ground. These can either be performed as an isometric exercise, so just lifting the chest up off the ground and holding for several seconds, or we can perform these for reps. There's really not a specific reason why we'd pick one or the other, so you can try both and see which one works best for you. Finally, we want to make sure to load the back extensor muscles in a more upright position. These can be performed with an exercise band either wrapped around our body or held in front of us. And the goal is to slowly extend the back, and we want to perform these over 3 to 4 seconds and then gradually increase the speed if we need it. Deadlifts can be another option to start loading the back extensor muscles. These can either be performed with an exercise band at first and then progress to some sort of kettlebell or barbell to continue increasing the load. And if speed is needed for returning to sport, then something like a kettlebell swing can be useful to prepare the back for those explosive movements that we're going to experience during sport. So hopefully this video on disc herniations was helpful. If it was, go ahead and give this video a big thumbs up. If you want to see more of my content, I'll put some videos over here. I'll see you in the next video.